Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I am proud to introduce you to Dr. Cathy Holway, a doctor of physical therapy whose own personal health struggles made her determined to utilize her knowledge to help others. As she puts it, her goal is to assist people in, quote, finding their landing so that they can bring self and source to service. What a wonderful mission that is, Dr. Cathy. All right, let's start with the basics. What is the mission of the Neurovascular Institute?
Well, thank you, Star. The mission of the Neurovascular Institute is to really help folks land in the fullness of their interoceptive processing of their belly, breath, heartbeat, their body, brain coherence. And it functions at different levels, whether it's a physiological issue, a disease issue, a problem like that, or whether it's a story issue where, you're kind of functioning out there, reacting to other people's stories going on and not landing in your true place within. So we meet you where you're at and help you slide in and land and find what makes sense to you.
Dr. Cathy, it's interesting because I had to do physical therapy myself after open heart surgery.
Mm-hmm.
It's a pretty intense physical therapy. I always liken it to boot camp because, I start off not able to literally walk 12 feet to my own bathroom.
Right.
And you don't graduate until 3 months later, and you can do a submax workout.
Right.
Work for 50 minutes with 1 minute breaks every 9 minutes. And so you just say to yourself, I'll never be able to do that again. And the fact that my physical therapist was ever able to bring that back to me, I'm a true testament to having someone who is your partner in coming back to yourself. Does that make sense?
Absolutely. It totally does. Because, in a way, it's not about using this technique or following this protocol. First, it's about the connection that you make. And so that the patient knows they are seen and heard and held. And from that connection, we figure out how to move you forward in a way that makes sense to you.
Dr. Cathy, I have to share this. I don't think I've ever told someone outside of my own doctors, but it's so funny. I remember doing physical therapy. You move from just being able to sit up in your bed to be able to walk to your bathroom and then walk around your inside of your house. And then you finally graduate to be able to walk outside. And I remember that first day that I was outside with the physical therapist right there next to me in tennis shoes and a jogging suit. And I'm just walking very gingerly. And all of a sudden I just started to cry. And the physical therapist she was so compassionate. She said, Star, please tell me what is going on. And I said to her, I'm so afraid that I'm going to fall and crack my chest. And instead of being empathetic, she started to laugh. She said, now listen, you're 48 years old. When's the last time you fell and cracked your chest? And that's what I needed. I needed someone to bring me back to using that good common sense that got me to where I am. So I have to tell you that connection with a physical therapist is absolutely imperative. I'm sure I just did a commercial for your business, but I don't care because that, I'm telling you, it 100% works. What first attracted you to physical therapy?
Well, it's a bit of an odd story. In the mid 1970s, girls going to college was, not about a career. It was about some kind of job. And I had taken the interest tests and medical stuff popped up. And so I kind of pivoted out of my multilingual artist writer space into, okay, let's go explore this. And it turned out that I was, darn good at it. And the neurology, the anatomy thrilled me. And then I was able to use that protocol to make the connection to my patients. And so it, kind of started here and veered there. And so there I was.
And since we were talking about different forms of physical therapy, what services do you actually provide to clients?
Well, across a range. Okay, so I do provide hands-on treatment, and my sessions are usually an hour long, one-on-one, on the table, where we help you land in your belly, breath, heartbeat, and start getting your wiring smoothed out in there. So there's direct hands-on treatment. There's also now in these COVID times, Zoom treatment. I do a lot of work on Zoom that is very powerful, and in some ways even more powerful than the old table time stuff. I also teach, and I run an online community now to help folks come together and work it out, figure it out.
Dr. Cathy, is it challenging to meet with clients during this global pandemic? I mean, we don't do as many gatherings as we used to do. I understand the physical issues, but I have to imagine there are some emotional challenges also.
Well, the first big challenge, Star, was that as I finished 2019, I had different treatment centers around the country, and I was on a plane every other week, and I would fly out there to take care of people in Wisconsin and Denver and Ohio. And when I couldn't fly anymore, that was, and wait, what? I live here? What? Was a little confusing. So it's taken like the full 2 years to really land here and feel how I can be of service right here. And yes, the table time is different. It's reduced, but in a way I can be anywhere I need to be right here on Zoom, helping people in their home environments, and that helps make their landing more real in a way.
Do you think there is a deeper connection because, as you and I are talking right now, we're talking virtually, but in order to actually have a virtual conversation, you have to pay attention.
Absolutely. Mm-hmm. And in all of my Zoom meetings, whether it's, a community meeting or a mastermind or a treatment session, we start with, okay, let's just slide in and take a breath and feel our breath and feel ourselves here. And then, oh, there you are. Okay. And then the connection starts. Mm-hmm. And that in itself is such a powerful engagement. Where else in our real lives do we get to sit still for a few minutes and be here?
Yes. And be present and actually be present. Your mind not wandering, you're not being distracted by 19 other things, but be present. And I hear you with that. I'm a big fan of quotes because they help me throughout my growth. And I know one that comes from you. I've heard that you said, your truth is greater than your trauma. Please explain that to us.
Yes, ma'am. Well, the way our culture works, our tribal containers work, is that when we've undergone trauma, whether it's physical, psychological, tragedy here, there, or the other, we are kind of committed to organize to a story about the trauma that may not access the truth of us within here, of how to move through it. And so we spend a lifetime of, oh, yeah, I've been diagnosed with that and labeled with that. And this one told me this. And okay, I guess I'm going to fake it from out there, or cortical overlords. But the reality is, when you slide in and feel your belly breath and know you're here and organize to what makes sense to you, your values in this world, how you understand the world out there, that's what guides you forward in your healing. And what I learned when my brain damage was healed and my processing totally changed. I learned, wow, you can only save your own life, but you don't have to do it alone. Mm-hmm. And this is what we do. We hold your edges, we hold the container, we guide you within so that you can navigate your way out there to the meaning, with the meaning of your life.
And you've actually moved through your own personal trauma. And I never say get over it. I say move through it because
Mm-hmm. Yeah.
it is a part of who you are, just like
Yep.
successes and setbacks are a part of who you are. Hopefully, you grow with each one of those things. So, triumphs and traumas are a whole part of who you are. So I'm thinking, without violating any doctor-patient privilege, are there any success stories with clients that you can share with us so that we fully understand what you're sharing today?
Well, I do have a success story about a little baby I worked with
Okay.
who was born with a defect in her larynx, so that when she swallowed, the flap didn't close. So what she swallowed went into her lungs, and she was aspirating and unable to, use this mouth and feed properly, no matter how much she wanted to. And so when I met her at 5 months old, she already had a feed tube in her belly because this was not reliable. And so we started the work. And here's this little baby in my arms, and she's, she'd give me the side eye, like, come on, let's get in here and get to work already. And within 3 months, her larynx had healed. Her oral motor function was so functional that they were able to remove the feed tube.
Oh, what a blessing.
And the ENT is saying to the parents, I don't know why this is possible. And the parents are like, we can't really explain it, but here's this sweet little girl. And we worked for quite a while to get her organized right here for breath, for sleeping, for swallow. And now she's a quite rambunctious young lady turning 5 years old, and all good.
Now that's a success story for you. I mean, we don't have time for you to give us all your methodology, but trust and believe, to be able to take a 5-month-old who is nonverbal,
Exactly.
and you don't get the feedback this way, a toddler or an adult would be able to give you. So
Yeah.
you really do have to be in tune
Yes.
with that patient, 100%.
Yes. And it's fascinating, Star, when you're present like that and you learn that language of connection and engagement. And here she is in my arms, like, the side eye. And then I'm like, really? First, you got to wire up this, and then we can do that. Wow. Okay, let's go. There it was.
Wonderful, wonderful, wonderful. Dr. Cathy, what does the future look like for you?
Well, Star, what I am ready for right now is to create a fuller online presence. So yes, we will have more opportunity to meet for treatment, but yes, also I'm ready to get back to my seminar business right here, because I can teach you the hands-on of the work on Zoom right here, and also to grow the community. I started my community platform just a few months ago, and already it's having a landing place out here is so helpful and transformative for folks in here. So, yay, treatment, teaching, community work.
It
And
sounds just like growth.
yes.
Absolutely. It is growth. And it's growth taking into account what we now refer to as our new normal.
Right.
And it really is an opportunity for us to rethink what communication is, rethink what connection is,
Right.
and to find communication and connection in whatever manner life throws at us, because we still need communication and connection,
Yes.
no matter what is going on. What, Dr. Cathy, do you think is the one thing you'd like the viewer of this video feature to walk away with today?
Hope. Okay, there is hope. All right. With your next breath, you can slide in, you can land, and you can start to make sense of what is true for you. And so trust that you're still in here. How many patients say to me at the end of a treatment, I'm still here? Yes, you're still here, And we're here to hold your edges and help guide you within to find what's true for you and how you can be here in a way that makes sense to you.
Okay, I'm going to ask for some free treatment right here. Is there a breathing exercise that I can work on that we can share before we say goodbye?
Absolutely. This is what we do. First, sit back and let out the big exhale, because you got to make room for the inhale. And then when you go to inhale, Star, inhale and feel your belly expand all the way down there, so that fills up. And then when you exhale, you start to slide in and soften and land in your belly, and find your rhythm of the inhale where everything expands, and the exhale where then you soften in and slide in. And as you find this rhythm of the inhale with the belly expanding and the exhale with the softening, your clenched circuits let go, and your belly, breath, and heartbeat and brain find their coherence again. And then you can breathe it, feel it, and name it what's possible now.
That feels really good.
Yes. Yes.
Okay.
Yes.
Tell me where to send the money. Thank you so very much for your time today, Dr. Cathy. It's been a wonderful pleasure to get to know you and to chat.
Thank you so much, Star. Yes, it's a pleasure, and happy breathing. Okay.
Happy breathing. Thank you.
Okay, thanks.